Hello, everyone, and Happy New Year 2022. We welcome you all to the Happiness Journey with Dr. Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a cognitive behavior psychotherapist specializing in anger management issues, both court-appointed and private, marriage counseling, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also provide life, business, and retirement coaching support. I provide individual one-on-one session and also do group setting. If you need any assistance, reach out to DMV Therapy and Coaching Services at 301-325-1550. And our website is lifecoachdanamzalai.com. Today, I'm very excited to have for our 7th episode of Season 4, a very special guest, Lisa Skinner. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. Lisa, the floor is yours.
Thank you, Dr. Dan. Thank you so much for having me on today. It's a great pleasure to be here. So my name is Lisa Skinner, and I am a behavior specialist with an expertise in the area of Alzheimer's disease and other brain diseases that cause dementia. And I think that that's a great segue into having me explain the difference to y'all between Alzheimer's disease and dementia. A lot of people think they're two separate diseases, which they are not. So Alzheimer's disease is a brain disease, and it's one of over 100 brain diseases that actually cause dementia. So dementia is a syndrome. Alzheimer's disease, Parkinson's disease, Lewy body disease, those are actual brain diseases that cause dementia. And when we use the term dementia, we're really using it as an umbrella term to describe the symptoms that accompany the brain diseases. And each one is a little bit different, has a different hallmark. So the most common brain disease that causes dementia is Alzheimer's disease. And as most of you are probably aware, the hallmark of Alzheimer's disease is it impacts and damages and affects the short-term memory. Correct. Parkinson's disease, to use as another example, it doesn't so much affect the short-term memory as Alzheimer's disease does. The hallmark of Parkinson's disease is hallucinations, but people retain their short-term memories for a longer period of time than people who are affected with Alzheimer's disease.
But so motor skills are involved, right?
Pardon me?
Motor skills are affected with Parkinson, but not with Alzheimer.
No, that happens with Alzheimer's disease too.
Oh, it does as well. Okay.
Yes. And the thing that really gets complicated with brain disease is a lot of people, it's not uncommon at all, for people to be suffering from more than one brain disease at the same time. Yeah. So that just adds insult to injury. It's very common for somebody to have Alzheimer's disease and then Parkinson's disease on top of that. So several parts of the brain are being damaged simultaneously. And then you're going to see a different set of symptoms in that person versus somebody that might just have Alzheimer's disease. But they're all interrelated. So when I say that dementia is really referring to the symptoms, one of the ways that I can help people understand what that really entails is think of maybe the last time you had a cold and you started displaying symptoms, and people's symptoms vary. Some people will get chills and some people will get it just really in their head. And I just got over a cold about a month ago and it had settled in my chest. So those actually are the symptoms. But when you tell somebody that you're sick and they say, oh, what's wrong? You'll say, oh, I have a cold. You typically go through all the symptoms that you're experiencing, unless, of course, you're talking to your boss or your doctor. Yeah. So when we use the term dementia, we're really referring to the symptoms that fall into the bucket that's associated with any of the brain diseases that cause the dementia. And it's complicated there too, because there are actually probably over 100 symptoms and behaviors that accompany brain disease. And everybody experiences it a little differently. You can have 100 people in a memory care facility that have all had a diagnosis of Alzheimer's disease, and each one experiences it and displays the symptoms and the behaviors a little bit differently. And then when you add another brain disease on top of that, or multiple brain diseases, then that just makes it a little bit more complicated.
Is there a different spectrum of Alzheimer? Like, we could have, for example, if you're talking about autism, you could have severe autism. We could have Asperger, which is highly functional version of autism. Is there the same thing with Alzheimer? Can you be somewhat functional with Alzheimer?
In the beginning stages. So Alzheimer's disease is progressive. It's degenerative, which means that it's killing off your brain cells as it progresses through the various stages. So that's a great question, Dr. Dan, because this is of great concern to a lot of people. A lot of my family members, clients ask me, how do I tell if I have something more serious going on, like an Alzheimer's disease, or maybe I'm just experiencing forgetfulness based on the normal aging process.
Correct.
And that's where it gets a little tough in the beginning stages, because the signs and the symptoms in the beginning stages of Alzheimer's disease are actually very subtle. And they can mirror or be very similar to the memory loss that we see with the normal aging process. Like, where are my glasses? Oh my goodness, they're on top of my head. Or where are my keys? I mean, we've all experienced that. Why did I walk into this room? I can't remember. I mean, we can all relate to that.
Absolutely.
Now, that doesn't necessarily mean that you're developing a brain disease, or let's just stick to Alzheimer's disease since it's the most common brain disease. And most people, surprisingly, are not even diagnosed with Alzheimer's disease till they're already into their mid-stage, because the signs, symptoms, and behaviors are subtle in the beginning. It is very difficult to tell whether or not you have something more serious going on. So it's a waiting game. And then as they progress into the middle stages, then it becomes pretty obvious that there is something more serious going on. So some of the examples that you can look for that is very different than just the normal aging process is you reach a point where a lot of people start displaying what we call repetitive behavior. And this takes many shapes and forms, but one of the common ones is if you're sitting in the living room, you're having a conversation with somebody that's already in their mid-stage of Alzheimer's disease, they might repeat the same story to you over and over again in the same conversation, or ask the same question over and over again in the same conversation. And I know a lot of family members don't understand that this is part of the disease, and they become pretty annoyed by it because they keep asking the same thing over and over again. But the disease has already started to severely damage the short-term memory. And honestly, that person does not remember that they just asked you that question or told you that story 2 minutes ago.
What about, does it affect long-term memory versus short-term?
The short-term memory is the part of the brain that is the most seriously damaged. And over the course of the disease, with most people, the short-term memory will disappear completely. They will have no short-term memory function at all, typically by the end of the disease, or some people might have very little of their short-term memory. The long-term memory stays intact pretty much for the remainder or for the course of the disease up until maybe the very, very end. But by the most severe stage, people really are not very functional at all. They are not able to speak. They're not able typically to swallow. They can't do any activities of daily living for themselves. But for the most part, the long-term memory does stay intact for the duration of the disease. And that's the whole reason why people with dementia at some point don't recognize their family members. It's because once that short-term memory is completely erased, they're pulling from their long-term memory. And based on what period of their life they're pulling those memories from, a mom might not recognize her adult son because in her mind, she's 18 years old and she hasn't even gotten married yet, let alone had a son. So that's one of the things that I teach is what cues to listen for from people with dementia, so you can kind of tell if their short-term memory switch is on or off. So in the very beginning stages of the disease, that short-term memory switch is on more than it's off. And they can have very, lucid conversations with people. About in the mid stage of the disease, it goes on and it goes off at random. Okay. And then, as I mentioned a few minutes ago, by the end of the disease, that short-term memory switch is pretty much shut off, and they are living in some other period of their life because they're pulling from the long-term memories that stay intact for the duration of the disease. So let me give you an example. If you have a parent in a memory care unit and they're pretty well into their mid stage of the disease, and you show up and they know they recognize you, but they can't place exactly how you fit into their life. And let's say they call you a different name. A lot of people take it very, very personally, and they're very hurt by the fact that their own mother or father didn't recognize them. But this is the cue to listen for, because if they call you by a different name, they're associating you with somebody they knew from their past. Okay. So you need to listen for the cue to figure out what period of time they are actually having their memories surface from. And it's very, very common, this occurrence. And when that happens, just think, oh, mom's short-term memory switch just got shut off. It's usually temporary until the end. And she's talking about me like I'm her next door neighbor, little girl who lived next door and we were great friends. Don't be alarmed by that. Go along with that reality, because in her mind, it is her reality. She's pulling from her past memories, and there's nothing anybody can do or say to change that paradigm for her. You have to wait until the short-term memory switch goes back on. I see. And eventually it will shut off completely, and that person is kind of stuck, if you will, into a past time frame of their life, and it's different for everybody. I've seen people regress to the prime of their life. I've known men, who are in their 80s, whose short-term memory switch keeps going on and off, and in their mind, they're still, a practicing attorney, and they're looking for their office every day. Wow. I've seen people regress to childhood, and the things that they're talking about is, have you seen my mother? I can't find her. Mm-hmm. And she'll be worried about me. Can you help me find her? Well, that person is back into their childhood. I've seen people revert back to their adolescence. So based on where their long-term memories are being pulled from is where they're going to believe they are in their life.
I
So
see.
listen for the cues and then just acknowledge that existence until they can come back from it. And then once they stop coming back from it, then you pretty much have to join what we call join their reality.
Yeah, they will, exactly. But is there a specific age, Lisa, where someone can say, phew, I passed the 70, I'm not gonna get, I'm okay now, I'm not gonna get Alzheimer. Can it hit at any age after a certain period of your life? Or is there something that can trigger Alzheimer to occur?
Okay, well, that's kind of a complex question with a complex answer, but I will explain it as best I can because it's more involved than just a one word or a one sentence answer. So the common form of Alzheimer's disease that most of us have heard about typically shows up in a person after the age of 65.
Okay.
And you're right, it can show up anytime after that. If you're past 90, there's a pretty good chance you're not going to develop it. But I have known of people who are already in their 90s who have been fine, and all of a sudden they develop dementia.
I see.
So the answer to that question is it can happen anytime after the age of 65. But there's an exception to that. There's another brain disease, which is a more rare form of Alzheimer's disease that's called early onset Alzheimer's disease. And this is a genetic disease.
Okay.
So it runs in families. Alzheimer's disease also runs in families, but there's no gene that anybody carries that might make them more at a higher risk, with the exception of early onset Alzheimer's disease, which people do carry the gene for that disease. And if there is a test out there that can determine whether or not you are carrying the disease, and if you are, that places you at about a 50% risk of developing early onset Alzheimer's disease, and that can show up at any time before the age of 65. I've known of people in their late 20s, early 30s that have developed early onset Alzheimer's disease. The diseases are very similar. The symptomology is very similar. The progression of the disease, it's all pretty much the same, except for when it shows up in the individual person.
So is there a specific test or a name of a test that someone can do? Look, so if they do an MRI, would they see it on the prefrontal cortex that there's something wrong? Where would that sign that the doctor will say, ouch, this is the beginning of something? Or do they have to wait for full-blown Alzheimer before the doctor says, oh, well, you got Alzheimer?
The one brain disease that can show up in the prefrontal cortex is called frontotemporal lobe dementia, or brain disease. And that one usually is the one that exhibits very severe behavioral problems because it's damaging your judgment, your reasoning, your emotions, your personality. Although you can display those kind of behaviors with just regular Alzheimer's disease. But the answer to that question is there really is no test yet that can diagnose accurately Alzheimer's disease. The doctors typically have to go through a process of elimination and a series of little like mini mental exams. And if it's not something else, then it's more than likely Alzheimer's disease. But then again, you can have more than one brain disease happening at the same time. And right now, the most accurate way to determine if somebody was suffering from Alzheimer's disease is to do an autopsy of the brain after they pass away. And the hallmark of Alzheimer's disease is when plaques and tangles form in the brain and start suffocating and killing the brain cells.
Okay.
But other than that, it's really kind of a process of elimination and a variety of different tests to determine if that's the disease that's prominent in the brain. So that's why I'm saying it's so complicated, because like I said, another common combination that people suffer from is Alzheimer's disease and what's called vascular dementia. And vascular dementia is caused by people having strokes or what we call trans-ischemic attacks, which are mini strokes. You might not even know you've ever had one. You don't feel them, but it's a little brain bleed. And it does show up in an MRI. And so they can determine if somebody is suffering from vascular dementia because they can see the damage in the brain from these mini strokes or even just a regular stroke. But people can have Alzheimer's disease and vascular disease at the same time. They've had, a series of mini strokes that have damaged parts of the brain, and then they also have Alzheimer's disease. So again, it's a very complicated, difficult disease to really, even for doctors to wrap their heads around, because there's so many variables that enter into the picture.
So if someone deals with vascular dementia, does it automatically will render like Alzheimer, or is it possible that they may have vascular dementia but never end up with Alzheimer? Or
Correct.
Okay, so
Correct.
it depends on the gravity of those seizures, whatever it is, or how does it work exactly? I mean, how many of those strokes did you have to have before Alzheimer becomes prominent?
Well, you can have one, and then it can cause dementia. You may never have Alzheimer's disease for your entire life, but if you have strokes, either a regular stroke or these mini strokes that cause damage to the brain, it will cause the dementia, which is the symptoms that accompany the damage that has been done to the brain. So the strokes cause that, and you may never have Alzheimer's disease. A person that is suffering from vascular dementia and only vascular dementia may have lived their entire life with no brain disease at all if it hadn't been for having a stroke or these mini strokes. But all it takes is one to do enough damage to the brain cells.
So the vascular dementia is not progressive or degenerative. It can happen one time and you're doomed.
Yes.
Okay. So is there a way, Lisa, that people can change now, especially that we're in the month of January, people are having those New Year resolution. Is there a way that you can, for example, if let's say you go and eat junk food, you can be certain that obesity will be in your future. So that's something that you can stop it from happening by changing your eating habits. So is there a way for Alzheimer to be able to, like, is there any brain food that you're going to eat more often that can help you? Like, that some kind of nuts actually helps with improving mental capabilities and prowess. Certain type of nuts, I know that you could eat more of it and then feel like more smarter, that is. But is there anything else that you can do that will help alleviate, or I would say avoid getting an Alzheimer?
Absolutely, yes. So let me preface the answer to that question with letting people know that there are many, many risk factors that go into a person's chances of developing Alzheimer's disease. So there are modifiable risk factors, meaning you can't do anything about them, they cannot be changed. And then there are modifiable risk factors, which exactly what you're alluding to, you can manage them and lower your risk. And the more risk factors you have that pertain to you, so in other words, the cards are just continue to be stacked against you, the higher your risk is to develop Alzheimer's disease later on in your life.
Okay.
So let me go over a couple of the non-modifiable risk factors, and then I'll talk to you a little bit about the ones that you can manage and change and do something about. So, and everybody who has the non-modifiable risk factors they're automatically, if you qualify for those risk factors, you're automatically at risk.
Okay.
It doesn't mean you're going to develop it, but it places you at risk. So age is the number one risk factor of developing Alzheimer's disease. And of course, we know that it shows up after the age of 65. So if you're 30 and you're not worried about it because that's 35 years or more away, you can't modify that risk factor, but you can do things now to lower your risk when you're 65. The second non-modifiable risk factor is your gender. Being female puts you at a higher risk for developing Alzheimer's disease than being male. There are more females that develop Alzheimer's disease than males. And, the medical community is not exactly sure why. The thinking process is because women live longer than men, but there are more women that are living with Alzheimer's disease than men. Your ethnicity places you at higher risk factor. So right now we know, according to the Alzheimer's Association, that if you're African American, Asian, Pacific Islander, or Hispanic, your chances of developing Alzheimer's disease are higher than people that don't have that ethnicity background. So these are all things that we can't change. Now, in terms of the modifiable risk factors, the number one modifiable risk factor for developing Alzheimer's disease, and this might surprise a lot of people, is cardiovascular disease.
Wow.
So if you suffer from a heart condition, hypertension, high blood pressure, any of those medical conditions, you are at an increased risk of developing Alzheimer's disease. But the good news is it can be managed.
Correct.
With medication and surgical procedures and things like that. So again, you already have several non-modifiable risk factors stacked against you. The number one is age. And then if you fall into the other categories of non-modifiable risk factors, you got to throw those into your risk factor pile. And then you start adding on the ones that you can manage. So cardiovascular disease, diabetes, sleep apnea, hearing loss has been connected with developing Alzheimer's disease. Again, it's manageable. You can wear hearing aids.
Yes, correct.
To correct that. Now, studies have been done for decades in terms of this topic that we're talking about, and there has definitely been studies that demonstrate that your lifestyle can make a huge difference in your risk of developing Alzheimer's disease when you're later in life. Now, so if you're in your 20s, if you're in your 30s, if you're in your 40s, you can start implementing a variety of things into your lifestyle that will lessen your risk or lower your risk of developing it. Number one is, and you nailed it, Dr. Dan, it's your diet.
It's what you
and
eat.
you probably know that just from the work you do. And, we all know that junk food does contribute to obesity, and that increases your risk of developing Alzheimer's disease. But it's recommended for people to try to live with a diet that's kind of more of a Mediterranean based
Correct.
style. So we're talking about
Lentils and chickpeas and all of those vegetables.
lean meats,
Yes, lean meat.
less red meat, more green leafy vegetables, not simple carbohydrates. Those are the really dangerous foods. Our sugars, anything white rice, white bread, white potatoes, simple carbohydrates. Those are the worst foods for us. So if we switch the white rice to brown rice, we're doing ourselves a huge favor. If we switch our white bread or anything that is made with the enriched white flour, we are doing ourselves a huge favor in terms of lowering our risk of developing Alzheimer's disease, even if it's 35 years or 25 years or 40 years away. These things are all important, and the studies have basically proven to us that you are what you eat, and what you put in your body makes a difference. And it includes developing Alzheimer's disease, among so many other medical problems that show up in our lives from from eating simple carbohydrates versus the complex carbohydrates, the whole grains and the nuts that you mentioned, and things like that.
Yes.
What did you say?
Walnuts, because if they made a comparison which is quite amazing. They said the walnut, when you open it, it looks like a brain.
It does.
It's a
yes.
For brains. They said other, like for example, there's avocado, which is also good for, I think, the kidneys or the liver. There's specific foods that are appropriate because of the form and the shape of the food, appropriate to an organ, which is quite amazing, and the benefit that it does when you eat them on a regular basis. Again, everything is moderation. You cannot eat 50,000 pounds of walnuts. That's not going to be healthy because, again, this pretty fatty. But overall, it does. It's what you eat and how you exercise as well. Because if you exercise, these are modifiable factors that will alleviate you to becoming obese, to having high blood pressure, to having high cholesterol, high triglyceride. So all this you could fix it. But diabetes, of course, this is related to the sugar that you intake with all the crap that's out there,
and lack of exercise. So that's the next very important thing, as you say, to implement into your lifestyle is regular exercise. And it doesn't have to be the old no pain, no gain way of thinking. They have discovered that walking 20 or 30 minutes is really beneficial to getting that exercise to negate the risk of developing Alzheimer's disease.
Correct.
So, and then the other thing that is recommended is keep your brains active. Just like, if you go to the gym and you're trying to keep your muscles from atrophying or shrinking or getting weak, we need to continue doing those types of things
for the brain. Yeah.
For the brain. And the number one thing that they recommend for challenging your brain and keeping those neurons firing is learning a foreign language, because of the parts of the brain that it takes to actually make that happen. You're having to translate in your brain from one language to another. So learning a foreign language is a great exercise for your brain. Learning a musical instrument is a great exercise for your brain. Doing puzzles or Sudoku, things that really make you think, is what they're recommending. It's not necessarily watching Jeopardy on television. because somebody else is doing your thinking for you.
Correct. Yes.
So you really have to kind of strain your brain and make it work to have it matter in terms of keeping it, exercised.
And reading also, I think reading is always allows you, especially reading something that is somewhat complex. Like if you start reading quantum mechanics, is going to help you force your brain to be able to understand the material, the content of what you're reading, and that will allow those neurons to fire more often, and then will make you more curious to learn more about the subject, which will allow you to be able to continue getting your brain working in your favor. So all those exercises are definitely a way to be more proactive instead of reactive, because unfortunately, once you have Alzheimer, there's no turning back. That's
No.
It is what it is. I mean, you're going to have to deal with this degenerative disease and having to cope with those changes that are happening in your mind and in your brain. So might as well be proactive. And unfortunately, people don't have this mentality, Lisa. They just said, oh, it's in 30 years from now. Let me enjoy my life. Okay, this is how they look at it. But the thing is that when you go and work until you're 65 or 68, and then you retire, and then the average lifespan of someone is around 78 years old. So you're going to be working until you're 68 to take advantage of 10 years of your life to be able to retire, and to what? To suffer from Alzheimer during that time? Doesn't make any sense. So people are just not responsive to making the changes today that are easy to make. I mean, we're not asking you to run a marathon. We're not asking you to become Arnold Schwarzenegger at his peak with like muscles bulging out. I mean, exercising on a daily basis. And they also, I just read a new study. They said that instead of doing those HIIT training, which is high intensity training, they said that if, let's say, you go on a treadmill and you walk at a comfortable rate, let's say at 3.5 miles per hour or 4 miles per hour, they said that if you keep that zone or if you keep that speed, there's more chances for you to lose weight than having to do those HIIT training, which is running for like 10 miles an hour and then taking a break. If you are having that constant walk pace or that speed, you're more likely to burn more fat.
Yes.
But then again, it helps people to say, you know what? I don't need to spend 6 hours at the gym. I can do just like 1 hour. I focus on that 1 hour and I could get all the benefits from it.
Well, I'll have to tell you and also share with your listeners that this is a very personal topic for me in many ways. Yes, I do this professionally. I've got a degree in human behavior. I've been a behavior specialist for 26 years now, and I have counseled and helped thousands of families understand the disease. But I also have had 8 of my own family members succumb to one of the brain diseases, and there's a huge variety of them. And 5 of those family members are blood relatives. 3 of them were through marriage. So my first experience with Alzheimer's disease actually goes back almost 50 years when my grandmother developed it. And where I'm kind of wanting to go with this and alert people is I haven't seen a lot change in a half a century in terms of people's awareness, people's understanding of the disease. It seems to be kind of a taboo topic for a lot of people. They don't want to talk about it. They don't want to, it carries a stigma if one of your loved one has it. And I made a commitment years and years ago after my first experience, because I was very close to my grandmother and it was very traumatic for me to watch her disappear on me when I was a teenager. And she lived with it for 20 years. Now that's a long time. The average is 8 to 15 years, but the disease is a long course for most people. And to watch somebody that you love or care for decline from the person that you knew they were to somebody that basically can't communicate with you anymore is heart-wrenching. Mm-hmm. And there are many, many things that we can do to provide an environment for people living with Alzheimer's disease that they can still live a really fulfilling life with dignity and joy, because there's a person in there. You may not think there's a person in there because they're not the same person you knew, and they have a difficult time communicating with you. And sometimes they kind of seem like they're not there, but they are. They're breathing, feeling, caring human beings. And you can make a huge difference in somebody's life living with this disease if you understand it, educate yourself on it, and learn some of the techniques. And a lot of it is right up your alley, Dr. Dan. It's behavioral therapy, behavioral skills that can provide this positive, fulfilling, enriching environment for people living with the disease. It doesn't necessarily mean, oh, you got the diagnosis, this is the end of my life. It's not. You still have a lot of years to live with it, and it can be years of fulfillment and joy, but it takes some very specialized skills to make that happen. So this is the message and the awareness that I am committed to raise for families and people who care for people with Alzheimer's disease. It's a very different type of disease than caring for somebody with medical conditions, cancer or heart conditions or things like that. And there's a lot of hope out there. And the reason why I think it's really important to understand it and talk about it today is because between the World Health Organization's projections over the next 25 to 30 years and the Alzheimer's Association projections over the next 25 to 30 years, there will be double, if not more, the amount of people who develop Alzheimer's disease than are living with it today. Double in 25 to 30 years.
That is a scary statistic, Lisa.
It really is. And I haven't seen a lot change in 50 years. I think we need to, start
bringing awareness.
Yes, because of the numbers, the sheer numbers of people in the next 25, and it's around the corner. I mean, it might sound like it's a long way off, but it'll sneak up on us and we're not prepared.
You see, I mean, there's so much research, like Michael J. Fox with Parkinson. He's putting, like, I think he put almost $1 billion into research for Parkinson disease, but we don't see anyone representing Alzheimer the same way that they do with Parkinson. So I don't know why this brain disease is not really taken as the same level of importance as Parkinson. So it affects a lot of people as much as Parkinson does.
That's an interesting point that you bring up, because the number one reason why there has been no cure discovered is because there's not enough money being put into research for Alzheimer's disease as there is like cancer. I mean, look in the 50 years, the difference in the last 50 years, the strides we have made medically to cure cancer. But we haven't seen that with Alzheimer's disease, and we're going to be caught off guard with the number of people, not only in the United States, who are going to develop it in the next couple decades, but worldwide. And we really need to be prepared, because, again, these people cannot take care of themselves once they reach a certain point. And right now, the only way that you can pay for care is private pay, unless you happen to have a long-term care policy already in place when the symptoms develop, or you qualify for veterans benefits. But other than that, Medicare doesn't cover the cost of care it's all private pay. So it's becoming a very difficult, challenging situation for a lot of family members. And then with COVID, the last 2 years, and we're just getting into our third year, it's changed how people are caring, because we saw so many deaths in the care facilities. Mm-hmm. So care strategies and are drastically changing as a result of the impact that COVID has had on our society for people with Alzheimer's disease. So we're seeing a lot of changes, in coming down the pipe.
Definitely. Well, so if to give some aspect to our listeners, how can they find you, Lisa? If let's say some of their family members are suffering from Alzheimer's or the first symptoms of it, how can anyone contact you?
You can get a hold of me through my blog. I've been writing a blog for about 7 years now. You'll find it on Facebook.
Okay.
And the name of the blog is Not All Who Wander Need Be Lost. It's the same title as my book, which you can find on Amazon and Barnes and Noble. The book will give you a really comprehensive understanding of the disease. And then on the blog, I post a lot of the information that we've talked about today to help people have a better understanding of what living with the disease is really like and the things that you can do to provide an enriched environment for your loved ones. So those are the best ways, and you can actually message me through my blog and I will respond to you.
Beautiful.
So those are the two best ways, the book and the blog.
Beautiful. Well, Lisa, that is all the time that we have for today's podcast. I really do appreciate you taking the time out of your very busy schedule to join us, and thank you again for participating and inspiring our many listeners with your incredible story. Now, we hope that you have all enjoyed today's episode, and I'm also very excited about the many upcoming guests that we have scheduled for season 4 of the Happiness Journey podcast, filled with inspirational stories just like the one that you listened to today. Now, here are some concluding words of wisdom. You always must do something you're a little ready or not ready to do. I think that's how you grow. Where there's that moment of, wow, I'm not really sure I can do this. And you push through those moments, and that's when you have a breakthrough. It is during these difficult moments that you find your true self. It is during these moments that you can really determine how ready you are to accomplish your life goals. Nothing will ever be easy, because if it was, we would have a nation of Steve Jobs and Elon Musk. Thinking outside the box is key to step to the next level. If you want to reach the top, you must stay hungry and climb that mountain no matter what. It will hurt. You will experience many challenges, but at the end, it will be all worth it. My name is Dr. Dan Emzalag, and you may all keep pursuing your amazing journey in life.